Good morning, afternoon, and evening to everyone. Over the past few months, my colleagues and I worked with the Zambian Ministry of Higher Education to identify the factors affecting gender equity and the impact of COVID-19. We focused on equity and equality in STEM and present recommendations that directly address access, retention, and system strengthening.
We used the mixed methods approach to produce the report, combining both qualitative and quantitative methods. We started with a literature review across 4 themes: gender, economy, higher education, and the impact of COVID on Zambia. And then we did quantitative research using available data from reports, as well as field research through conducting qualitative research and interviews with key stakeholders in the sector. And finally, we conducted a root cause analysis based on our previous research.
We were able to identify 3 key results through this research. The first one being that the school to university pipeline for female students is restricted due to a lack of information and a lack of awareness. The second one being that there is low female representation and retention in STEM subjects. The third one being that females are underrepresented among university faculty members, and this gender disparity can be attributed to systemic issues in the country.
In order to address these challenges, we constructed 3 recommendations. Firstly, we recommend digital and in-person coaching, for example, using SMS to improve the resilience of students at college. Secondly, bystander intervention training to reduce gender-based violence at universities in Zambia. And thirdly, an information campaign to improve access for students.
Thank you very much for listening to our presentation today.
Our team, myself, Ivan, Richa, and Varun, have worked with the Ministry of Higher Education in Zambia to work around how to boost rural enrollment in TVET programs in Zambian higher education. Our work involved an assessment of barriers and recommendations to try and alleviate constraints in relation to access, equity, and quality. The work we've done used the methodology of interviews with government officials, literature review, and root cause analysis. And my colleague Varun will tell you what we were up to.
So through the root cause analysis, we tried to identify what are the potential constraints that reduce TVET take-up in Zambia. We find there are both supply side constraints and demand side constraints. Starting with the supply side constraints, we find that the distance to TVET and the quality of trainings offered by the TVET are potential constraints that reduce take-up. On the demand side, we find that lack of information about TVET centers, the low returns from going to TVET, liquidity constraints, and language barriers are potential reasons why students may be opting out of the TVET system. I will now hand it over to Evan for the recommendations.
Thank you, Varun. In the short term, we recommend that the government strengthen the TVET website by providing more information and making it available in local languages. And we also recommend that the government expand the availability of responsive curriculum through increased partnerships with industry. In the medium term, the government, we recommend, strengthens monitoring and evaluation processes to assess and improve the quality of registered institutes. And we also recommend the government examine cost-sharing options with employers. In the long term, we recommend that the government increase opportunities for apprenticeships and also increase employer engagement in TVET to identify emerging relevant skills. Thank you.
So our team worked in partnership with the Ministry of Higher Education of Zambia to develop a better understanding of the challenges facing higher education in the country. Throughout our time together, we conducted a rigorous literature review and stress tested the findings to make sure that we were getting an appropriate understanding of the sector to better understand how we could come up with remedies in conjunction with the ministry. Our methodology, along with the literature review, involved desk research, as well as collecting various forms of data on Zambia's higher education sector. We assessed the relevance and accuracy of the materials and leveraged several frameworks to inform our hypothesis, analyses, and our final recommendation. And so with that, I'm going to turn over to my colleague, Pierce, who's going to go over our results and our recommendations.
Hey, thanks, Alan. Through a rigorous literature review process, we were able to understand the key drivers for the issue, which namely were lack of technology access, lack of tracking for digital skills for students, a less than optimal business environment, and suboptimal policies that aren't incentivizing higher university level faculty quality. So we ended up focusing on establishing a pipeline for teaching talent at the university level, regulating minimum qualifications, and ultimately investing in technology, which includes deregulation. We recommended to the ministry that that there needs to be an increase in tenure and to create other incentives to ensure that the university level teaching is a more desirable profession. We need to regulate minimum qualifications for the public sector jobs, establishing more incentives to improve access to mobile technology for those who are historically underrepresented. And then ultimately, what will be important for increasing the tech infrastructure is going to be fostering a more attractive business environment and ultimately implementing a data management system for the higher education system in order to track these digital skills. So yeah, thank you so much for the support, and we really appreciated the opportunity to work on this important and exciting project. So thank you.
With support from the Harvard Ministerial Leadership Program, Adarsh, Bishal, Sun, and I assessed the impact of the COVID-19 pandemic on essential health service utilization and provided policy recommendations alongside partners at the Ministry of Health of Ethiopia. COVID-19 could result in substantial indirect morbidity and mortality due to disruptions in essential health service utilization that could outweigh the direct morbidity and mortality. Thus, our project aimed to assess disruptions in essential health service utilization in Ethiopia due to COVID-19 and provide policy recommendations based on policy analysis and literature review.
As a methodology, we use Ethiopia DHIS2 data to conduct quantitative analysis and calculated percent change in health service utilization between Q1 and Q2 in 2020. For qualitative analysis, using PETH COVID-19 Essential Health Services Policy Tracker, we compared Ethiopia's COVID-19 EHS maintenance policy responses to WHO guidance and police interventions adopted by Kenya, Uganda, Nigeria, and South Africa.
As results of our study, we found that the inpatient, outpatient, and the emergency visits were disrupted nationally. Similarly, we also observed an increase in institutional mortality. There were regional disparities in the disruption of health services. From the policy analysis, we identified key areas where Ethiopia could strengthen policy responses to maintain the essential health services during the pandemic.
Our recommendations to the Ministry of Health include considering additional policy interventions on RMCA services. These policy interventions could include leveraging health extension worker networks or digital tools, as well as further investigation into demand-side barriers around health service utilization. Limitations to our study include data quality, as well as access to both data and policy documents, the presence of other confounding events, and the evolving nature of the pandemic. Thank you so much.
Hi everyone, I'm Mia.
Hi everyone, I'm Kaylee.
Hello, I'm Adeze, and our fourth co-author is Tahani.
We'd like to present our work on multi-sectoral food programming in Ethiopia. And as a bit of a background, while there's been substantial accelerated economic growth for the past 3 decades, Ethiopia is still expecting challenges in meeting the WHO's 2025 targets for reducing malnutrition, as there are over 20 million people in the country still lacking access to food, or 1 in 5. In 2015, the government introduced the Sakota Declaration, which is a high-level commitment to ending child undernutrition by 2030.
So building off work from last year's HMLP program, we have explored the organizational, political, and programmatic aspects of the Sakota Declaration. In order to conduct our research, we combined key informant interviews with leaders within the health and agricultural sectors in Ethiopia, with findings from a desk review of peer-reviewed and gray literature surrounding the Sakota Declaration, as well as multi-sectoral nutrition programs in Kenya and Rwanda. We use these 2 other settings to compare and contrast program components and develop recommendations for future multi-sectoral nutrition programming.
Our findings show that Ethiopia's approach to tackling malnutrition via a multi-sectoral approach provides a valuable lesson for other countries in the region and elsewhere. Some of the factors that facilitate success include determining an ownership model that can stay constant regardless of changes in government, financial stability, as well as utilizing data for monitoring and evaluation purposes. Ultimately, changing needs in the country will require flexibility and willingness from the leadership to constantly evaluate and restructure the program as necessary in order to meet those top line goals. Thank you so much.
Welcome, everyone. Our group was tasked with carrying out a stakeholder analysis in the education sector in Sierra Leone for the Ministry of Basic and Senior Secondary Education. Our team comprised of Leah Anyanwu, Chiamaka Ikpeze, and Ryan Packerbush from the Harvard Graduate School of Education, and myself, Nandita Nair, from the Harvard Kennedy School. Our report includes a stakeholder directory, a visual map of stakeholders operating across Sierra Leone, and a snapshot of perspectives shared by various stakeholders in the education sector. Additionally, we offer recommendations that could strengthen the ministry's stakeholder relationships and improve sectoral communication and collaboration.
Our research question was, how can the Ministry of Basic and Senior Secondary Education create a sustainable stakeholder engagement framework to understand various actors' motivations, efforts, and leverage relationships to better align with education goals and standards? Stakeholder organization and collaboration is vital for the capacity to fulfill national agendas. We used a survey, focus group discussions, and archival research to collect data.
We highlight 3 of the most salient findings that the ministry can utilize to improve stakeholder engagement in the education sector. Issue-oriented networks that have a clear purpose and goal were viewed favorably in both the survey results and focus group discussions to guide future intervention design and priority policy areas. There was also a disconnect between the development partners' interest, interventions, and impact measurement. This is reinforced by the desire from development partners to have a more consistent data collection. Lastly, appropriate incentives are necessary for improved distribution of ministry staff and teachers to increase the level of support the ministry can offer its partners.
Based on the results, we propose the following recommendations. In the short term, improving communication and feedback loops between the ministry and stakeholders, and completing the visual mapping exercise that the team began. In the medium term, improving monitoring and evaluation systems, and finalizing a user-friendly data tool. And in the long term, introducing an interministerial coordinating team and scaling proven local efforts. Thank you.
One of the challenges that the education system in Sierra Leone continues to face is the lack of reliable data system to manage school level data. OTPS program was introduced to facilitate data-driven decision-making towards school improvement and to address the challenges that were described earlier. Our research focused on 3 objectives. The first one was to review the digital learning into school education plan and the implementation strategy in Sierra Leone through the OTPS initiative, to draw on the comparative experience in other developing countries to make recommendations on how the strategy can be strengthened for success and sustainability, and draft a monitoring and evaluation plan to assess the impact on the school performance.
Given the early stage of the 1 tablet per school program, we decided to actually focus a lot of our research methodology on qualitative data. That included a literature review, also included virtual focus group with the Teaching Service Commission. We also conducted an interview with the Ministry of Basic and Senior Secondary Education. We did incorporate quantitative data as it relates to teachers and student attendance data, and we provided also some comparative research of mainly African countries.
After our research, we had the following recommendation for the OTPS team. The first was to incentivize higher teacher attendance through monetary and non-monetary rewards, and also create very clear communication about the use of the data that is collected. We also recommended that they should invest in school management committees, which will comprise of parents and local chiefs, so that they create a broader network for school accountability. The fourth will be to make sure that there is very good training for teachers and everybody that will be using the tablets. Then finally, they needed to differentiate the support for schools in rural and urban context.
Hi, my name is Neftali, and I work with teammates Amelia, Claire, Han, Maria, Miyu, Sharia, and Yuan. We work with the Ministry of Gender and Children's Affairs in Sierra Leone to address their children in street situations. We found that COVID worsened the condition and likelihood of children living and working on the streets in Sierra Leone.
With the combination of both teams, we had 2 separate but connected research questions. The first one being to identify the principal factors contributing to children living on the streets in Sierra Leone, to assess how COVID-19 may have exacerbated the problem and recommend interventions to alleviate the situation, providing support including housing, feeding, and education. The second was to conduct a comparative analysis identifying lessons from programs addressing street children in countries around the world that can inform policy and programs in Sierra Leone.
For our methodology, we conducted 14 interviews with various stakeholders, including local NGOs, the Ministry of Education, UNICEF, the Mayor's Office of Freetown, and national point persons from the Philippines and Uruguay. Through this, we developed an understanding of the context and needs of street-connected children in Sierra Leone and determined the best practices and promising interventions from international contexts. Due to ethical concerns, we did not interview any street-connected children, although we did use transcripts and findings from interviews conducted with by an NGO with children living on the streets.
Through our interviews with stakeholders, we uncovered what the principal drivers of child streetism are, such as poverty, child trafficking, poor parenting behaviors, and costs of schooling. And we also conducted interviews with international stakeholders to form 4 case studies around 4 countries, Uruguay, Philippines, China, and India, to extract policy lessons for Sierra Leone.
We recommended that the ministry align with the UN General Comment 21, that they strengthen their monitoring and evaluations, and developed an interinstitutional governing body to enforce and uphold the country's strategy.
Some of our specific ideas for action include addressing hidden costs of education and creating free access to vocational schooling, and offering positive parenting workshops to support nurturing family relationships. We also encourage enhancing training for leaders who work with street-connected children. We are super grateful for the opportunity to present these findings to the deans, and also really grateful for Karima, Michael, and Brian's support, and the wonderful opportunity to work with the Ministry of Gender and Children's Affairs in Sierra Leone. Thank you so much.
Hello, everyone. Thank you for joining us today. We are Team 4, and our project was identifying pilot districts for the Girls Stay in School program in Sierra Leone. In December of 2019, the Ministry of Education in Sierra Leone proposed developing and implementing the Girls Stay in School program. The program's goal will be providing girls with material incentives via cash transfers as an incentive for school attendance and completion. Our team was able to build off of the white paper led by Dr. Zoe Marks.
The section of our literature review in the report examined gender issues in Sierra Leone, such as gender-based violence, poverty, teen pregnancy, and how a cash transfer program could also help alleviate these disparities and promote women's empowerment.
So in order to help the ministry to decide in which districts to pilot the program, we drew on data from the Demographic and Health Survey to create 2 indices. The first of those was based on 13 indicators in 4 dimensions: education, teenage pregnancy, gender violence, and women's empowerment. And we also created a second index, which adds an indicator on poverty, so the ministry could decide which districts would be more suitable to the program.
We recommend focusing the pilot on regions where school enrollment is mainly related to factors like poverty and early marriage, rather than the supply of schools, since we think that the program has the most potential to have an impact there. So using data from the 2019 school census, we calculated the average distance to the nearest secondary school for each district. This table illustrates how the districts perform with regards to the 2 suitability indices and the school distance. We find the Kirini, Cambia, and Tonkulila districts at the top, suggesting that they would be appropriate for the program pilot. Based on these results, we recommend that the ministry decides whether alleviating poverty is a key program goal, and then use the corresponding index to guide their district selection. We also propose giving preference to districts where school supply is less of a binding constraint, and suggest that long-term action is taken to increase the overall number of schools and the number of classes for overage girls.
Hi all, I am here with Charlie and Patty, and we are representing the Ministry of Education working with Ghana. And together with this team, we essentially work to assess the teacher credentialing program. Take it over, Charlie.
Great. So as Jill said, we worked with Ministry of Education Ghana to evaluate the outputs of their 2017 education reform and compare to 3 other countries undertaking a similar reform. Our methodology was to first use a desk review of secondary sources to get an idea about the background of education reform in Ghana. And then secondly, we conducted key informant interviews with members of the Ministry of Education and kind of affiliated stakeholders. So now I'll turn it over to Patty.
Yeah, thank you, Charlie. So Ghana is doing an extraordinary job. They're using local intelligence and resources and also included a lot of stakeholders. So based on that, we are recommending to prioritize reforms above political changes. A new leadership is now guiding the Ministry of Education, monitor and allocate resources, survey and other stakeholders, and the most important is to assess the teacher professionalism and embed a cohesive plan into all aspects of the institutional framework. So this is all the results and recommendations. Back to you, Joe.
Yeah, thank you, team. There you can see us working with the Honorable Minister of Education, Dr. Prempeh. It has been lovely to work with the Ministry of Education, and that's all for now. Bye.